promote cancer prevention. Share ways to reduce specific cancer risks. As a community health worker, an important part of your role is helping your patients understand their individual risks for specific cancers and how to lower those risks. I've had many of these conversations with my patients over the years. Let me share a few stories that show how we can turn everyday moments into opportunities for cancer education and prevention. Colon cancer. Just yesterday, I spoke to a patient, Elias, who was celebrating his 50th birthday. I reminded him that he was due for his colon cancer screening, as the risk increases with age. While he didn't have diabetes or a family history of colon cancer, both of which are risk factors, his diet was a worry. He was eating too little fiber and too much red and processed meats. I encouraged him to eat more fruits, vegetables, whole grains like brown rice and beans. I also suggested he cut down on red meats like beef and processed meats like sausages. His birthday turned into an important opportunity to talk about cancer prevention. Liver cancer. Tomas, my neighbor, drank a lot of alcohol, which increased his risk for many cancers, particularly liver cancer. I spoke to him about stopping or even reducing the amount he was drinking. Fortunately, he didn't have liver cirrhosis, hepatitis, or diabetes, which all increase liver cancer risk. His hepatitis B vaccination was also protective. I kept counseling him until he finally stopped drinking alcohol. Prostate cancer. Now let me tell you about James, a healthy 51-year-old. Even though he felt fine, I explained that being over 50 and having a family history increased his risk of prostate cancer. I encouraged him to go for screening, and his cancer was caught early and treated successfully. He will be turning 70 this year. Breast cancer. This morning, I spoke to Princess, a first-time mother at the age of 35. Having her first child after age 30 slightly increases her risk of breast cancer. So I encouraged her to breastfeed for as long as possible, as it helps reduce the risk. Luckily, she did not have other risks like being past menopause, having a family history, or not having children. I taught her how to do a breast self-examination and shared information about screening. This made her feel more in control of her health. Cervical cancer. I am reminded of young Amy, who asked me about contraception when she had her first boyfriend. We talked about how early sexual activity, unprotected sex, and multiple partners can lead to sexually transmitted infections like syphilis or HPV infection, which can cause cervical cancer. I recommended using condoms, staying with one partner, and getting herself vaccinated for HPV. We also discussed regular screening and the importance of not smoking. She is now married and shares what she learned with her own daughter. Lung cancer. My last story is about lung cancer. John was a smoker, and his father died of lung cancer. His smoking and family history increased his risk, and his wife and children were exposed to his smoke, placing them at risk as well. While lung cancer can affect anyone, smokers and those exposed to other people's smoke, air pollution, or asbestos have higher risks. Until he was able to stop smoking, I told him to smoke outside and keep the windows open when cooking to reduce air pollution. I also encouraged him to wear a mask in areas where air pollution is high. He is smoking less and will hopefully stop soon. Each of these stories show how understanding specific cancer risks can help you personalize your health teachings.